today on 333. We had left off at the top with a dormitory effect. Did we explain that at all?
Yes.
Okay, and hopefully you read through that and got a grasp of that, because there's a high quality test question over that issue on the test. So it leads us to the adrenal glands, and you have two components to the adrenal gland. You have the adrenal medulla and the adrenal cortex. The adrenal cortex is producing your cortisols, which the anterior pituitary secretion of adrenal corticotropic hormone is going to cause the production of the glucocorticoids from the adrenal cortex. On page 334, they list three functional categories of corticosteroids that come from the adrenal cortex. Mineralocorticoids, which we'll get tired of this one before it's over, that's aldosterone. Glucocorticoids, which is your anti-inflammatory, anti-stress hormone that we discussed earlier. If you have allergies and take a seasonal shot for allergies, that's a glucocorticoid. If you're in a stressful state for a long period of time, your body's producing a lot of these. The only side effect to this is it lowers your immune system over time. And it works, does what it's supposed to do. We're made for short-term stress, we're not made for long-term stress. And the last one is sex steroids, and it's tiny amount, and there's a little bit of male in every female, and there's a little bit of female in every male. The adrenal cortex produces a little bit of androgen in every female, a little bit of estrogen in every male. I guess that's the feminine side of us guys, huh? So, as far as the mineralocorticoids go, aldosterone is your primary mineralocorticoid. We're going to learn a lot about aldosterone before we get out of this text. They may emphasize it just a little bit more in this chapter, but I'm not thinking they do. I think they wait to another chapter or two to really hit it. But it is a major part of what's called the renin-angiotensin aldosterone system. And to give you a brief of what this is about, renin is secreted by the kidney, and it's secreted due to low blood pressure, low blood volume. And so it secretes renin. Renin enters the bloodstream. It converts a substance called angiotensinogen to angiotensin 1. Angiotensin 1 circulates till it enters the lungs, and it's converted to angiotensin 2. Now, angiotensin 2 gives us an immediate response for vasoconstriction of the vessels, which will immediately raise some blood pressure. But then it goes to the adrenal cortex to give us aldosterone. Then aldosterone affects the kidney by reabsorbing sodium and excreting potassium. And over time, that will increase blood volume and increase blood pressure, because everywhere sodium goes, water follows. So urine output will be much less with that hormone involved. So you're going to see that in at least two more chapters. So that scenario I just gave you, you'll become familiar with. Look at clinical application on 335. Excessively high level corticosteroids in the blood causes Cushing's syndrome. High level, so an oversecretion of corticosteroids would be Cushing's syndrome. Now, symptoms, changes in carbohydrate and protein metabolism, hyperglycemia, hypertension, muscular weakness, metabolic problems give the body a puffy appearance, and can cause structural changes characterized as buffalo hump and moon face. Oversecretion of these. Now, if you know anybody that's been on long-term steroids, which could be anybody with a transplant that has to stay on them to lower the immune system so it accepts the transplant over time, or I've known a couple of cases where they've had to take long-term steroids and they have Crohn's disease. And you'll see the moon face. They'll reach the point of the moon face, but then they start weaning themselves off and they don't ever reach the buffalo hump phase. You know, that's almost a permanent situation once you get there. Now, Addison's disease is inadequate secretion. Well, inadequate's always an easier one to deal with than too much. It's hard to shut something down, but we can add, see? And adding, you see, John F. Kennedy had Addison's disease, and nobody hardly knew it because he was on proper medication for it. He had a smoky appearance, various tints or shades of deep amber or chestnut brown, caused by very high secretion of ACTH, which at that concentration can stimulate melanocytes, and high ACTH secretion results from inadequate negative feedback. So we was getting high ACTH, but we was not getting the mineral corticoids that we were supposed to be getting there. It was telling it to produce it, but we wasn't producing it. So that's where John F. Kennedy was, and then we supplemented it and created a normal life for him. Let's look at a couple things here that I think I've missed somewhere in the beginning of this chapter. There's two terms called pharmacological and physiological. And both these terms apply to natural productions of the body. Okay? Let's look at it like this. If you're supposed to put out a certain amount of a particular hormone, and you're doing in that normal realm, that's physiological. If you're lacking some, we can pharmacologically add to it to get it where it needs to be. Does that make sense? Whether it be metabolic with thyroxine, or like we did with Addison's disease here with John F. Kennedy. So, how many times you'll see advertisements or you see a drug say this is an all-natural component of your body. It will not hurt you. Like, for instance, melanin, or melatonin, not melanin, melatonin. You know, we take it for sleep aids. Well, we also know too much of it will cause depression. So, is it good to take more of a substance just because your body naturally makes it? Should we take more of it? Well, there's a normal realm there. And if you're in the normal realm, you don't need any more of it. And that's where people are misguided in this. It's the same with anabolic steroids. If your body's producing a normal amount and you take more, there's serious long-term consequences for that. You know, you get increased chances of major cancers, stunted growth, possibly depends on what age you start this, but sterility. We can kick in baldness sooner if you got that gene. That's mild compared to the cancer down the line that kills these football players as soon as they retire. What a retirement. They make all this money, and they've been on steroids since high school to make all this money, and they die as soon as they retire. And they're finding now most of them, if they don't die, they're stepping into Parkinson's and Alzheimer's due to traumatic brain injuries they never saw while they was playing. And that's why you're seeing stiffer penalties and rules. And then, was it last Saturday on a college game, Tulsa was playing somebody, and the team they was playing, the two teammates get a hit, and the guy they hit got down, and they hit each other. And they dragged that guy off the field. Now, there's a traumatic brain injury. And those are long-term serious, and they tend to be triggering the Parkinson's and Alzheimer's earlier in life. So that, all I can say is you pay the price to earn the money. The big bucks are there, but my gosh, some of them take a beating over a lifetime. Y'all played football. How many of y'all played football? I mean, just high school football. You took some thrashings, didn't you? Some of those hits hurt. So the helmets are nice. Can you imagine what it'd be without a helmet? Those old-time helmets with a piece of leather over your head. You know, those guys didn't make it very long, probably. But there's some long-term consequences. So to explain the difference of those, physiological is normal. Pharmacological is typically additive. If we need it, great. It's a great thing to be able to do that. If we're in the range of norm, don't add anything else to it. Too much of a good thing is not always a good thing. Functions of the adrenal medulla, that's your epinephrine, norepinephrine. Epinephrine is an endocrine secretion. It is a hormone. Norepinephrine technically is a neurotransmitter. When we get to the neurotransmitter chapter, they'll still have epinephrine in there because you can't separate these two. These two have additive, synergistic effects that we talked about on the previous page. They work together to give additive effects, especially to the excitement of the heart. Now, if you throw norepinephrine in the skeletal muscle down there, it does nothing. Acetylcholine excites skeletal muscle. You throw it in the heart and it does nothing. So it specializes where it's at too. That's huge. All right, moving on over to 336, stress in the adrenal gland. One of my favorite little sections here. A Canadian physiologist named Hans Selye did a study in rats, and he put rats through stressors. First thing he did is took a rat and he injected cattle ovarian extract into the rat. Well, he had to have sucked up a bunch of estrogen and shoved it into the rat by way of needle. Another stressor he did was inject a rat with formaldehyde. That would stress anybody out. And the other thing he did is he threw a rat in a tub of water and he made this rat swim to complete exhaustion. I mean, I'm telling you, the rat was going down for the last time. And I can just see him in this tub of water. He's got his little finger out here holding the rat, and the rat's just swimming away, and he's holding the rat until the rat goes down for the last time, and then he pulls him out. And he noticed all these things stress the rats out. Isn't this a brilliant science experiment? So, because of the stressors, this is what, it doesn't matter what kind of stressor, this is how their bodies reacted. Number one, simulated growth of the adrenal cortex. Adrenal cortex produces cortisol, anti-stress, right? So they're under such stress, the adrenal cortex started getting bigger because this rat's under serious stress. Number two, caused atrophy of lymphoid tissue, spleen, lymph nodes, and thymus. What are those involved in? Immunity. Too much stress, too much cortisol lowers your immune system. Atrophy of those says, forget the immune system, we're going to die of stress. And number three, it gave them peptic ulcers, bleeding peptic ulcers. So Hans Selye subjected these rats to all these environmental problems, and then he finally reasoned out the fact that these rats went through, all of them, no matter the stressor, went through a general adaptation syndrome. They generally tried to adapt to the stress to survive. And so, using that, is it synonym? I'm using the wrong term here. General adaptation syndrome, in essence, what Hans Selye was saying is that stress causes gas. That's what he said. So now you really know where gas comes from. I know y'all think I make a lot of stuff up, but that's in the book. It's right there. Hans Selye did this study. He was a Canadian. He might have been drinking or smoking something, but he still did the study, and it's in the book. It says, when a person suffers from stress of severe infections, trauma, burn, surgery, the cortisol level can rise in proportion to the severity of the stress to as high as 6 times basal levels. So when people especially they've gone through the trauma of, let's say, an organ transplant, they really don't want them exposed to every Jack and Jill that may be carrying some illness, do they, for quite a while? Because their immune system's shot. They're so stressed, their immune system's lowered anyway. And then they've got them on cortisol on top of that. So you can see how vulnerable they would be, and it's usually secondary infections that get those people in the long run anyway. Stress can thus make treatment of diabetes difficult, can contribute to constellation of symptoms associated with type 2 diabetes, and so anytime, well, for instance, diabetes is too much glucose in the bloodstream, right? Stress, one of the things it causes is increased glucose in the bloodstream, so you have the energy to deal with stress. So if you have diabetes, you cannot afford to be stressed. Get yourself out of anything that causes stress. You may have to just kick back and enjoy what life you have left and deal with diabetes directly and make it a focus of your life. T3 and T4, we don't need to spend a lot of time with that. We've already said T4 is tetradithyronine. It's thyroxine for short. That is the inactive form. It's in your bloodstream. And when we need it activated, once it finds its target cell, it'll enter it and become T3, tridithyronine, and become active. So that's enough about that. On 338, the other production of the thyroid gland is calcitonin. It is an antagonist to what other hormone? What hormone did we discover by killing a couple of dogs? You remember that? No. Almost. How about the parathyroids? We were doing thyroid studies on the dogs. We removed the thyroid, didn't realize we was taking out the parathyroids too. So parathyroid hormone makes sure you have enough calcium in the bloodstream, and it may actually take it from the bone if it needs to. Calcitonin antagonizes that and says don't take too much bone, just take what you need. So those are antagonistic. On the test, I'll ask you an example of antagonistic hormone. In fact, I think I have the question on 2 different tests. One of them will be insulin and glucagon. The other will be parathyroid and calcitonin. Now let's look at diseases of the thyroid. The first one they list is iodine deficiency or endemic goiter. This is abnormal growth of thyroid gland in the absence of sufficient dietary iodine. We typically don't see that particular kind of goiter much anymore, simply because most of the salt we use is iodized salt. And we eat plenty of it, whether we want to or not. Everything has salt in it, right? Canned goods. I mean, you make one trip a month through McDonald's, you've got your monthly quota of salt. Because they're going to salt those fries. And the ketchup has salt in it. They want you to drink more drink. That's where they make their money. They make about 300 to 400% on a cup of pop. That's their profit margin right there. So what's happening is thyroid stimulating hormones telling the thyroid produce more thyroxine, and the thyroid is trying to keep up with demand. So it's like a business out here with high demand. We have such demand, we got to get bigger to reach the demand. So the thyroid gland keeps growing, and it's producing something, but it doesn't have iodine in it, so the body doesn't recognize it as what it's supposed to be. Now that makes the thyroid gland really unique, though. You ever heard of anybody with thyroid cancer? It's actually a fairly common cancer out there, but it's one we've brilliantly controlled. Thyroid cancer in today's time, especially if it's caught early enough, is easily dealt with. And this is why. They go in surgically, remove all the thyroid gland they possibly can. But you know, with eye and equipment we have, we can't get every little rinky-dink cell. So at that point, they let about 2 to 4 weeks go by, and they're testing thyroid stimulating hormone levels. And those levels are skyrocketing. And the only cells that can even respond to those are the few fragments of cells we've left after surgery. At this point, they inject radioactive iodine into the system, and those are the only cells that will attract the iodine, and it's radioactive. When they come in contact, it kills those cells. We now supplement thyroxine in the diet. All thyroid cells are totally gone from the system. It doesn't even come back later. I mean, it's done. That's pretty, whoever come up with that was pretty sharp. We think of it like, well, that makes sense. Well, you had to think of that before you come up with it. That's what's sharp about that. But it works really well. It doesn't affect anything else. Not like chemo or radiation. Let's go ahead and kill the left side of your body, but we'll get the cancer. And that's what radio and chemo does, unfortunately. People who have inadequate secretion of thyroid hormone are said to be hypothyroid, and lack of thyroxine, and the thyroxine deficiency decreases ability to adapt to cold stress. Severe hypothyroidism in adults can result in myxedema, in which mucoproteins and fluid accumulate in subcutaneous connective tissues and viscera, producing edema that causes swelling of the hands, feet, face, tissues around the eyes. So myxedema. Now, if we look at on the right-hand page, well, there's hyperthyroid. Hypothyroidism can result from thyroid gland defect or secondarily from insufficient thyrotropin-releasing hormones. So a couple of problems there that can actually cause that issue. Cretinism is one we mentioned the other day, and it's listed on 339. Cretinism in an infant is not enough. This is hypothyroidism in an infant. And not only does it cause lack of growth, a dwarfism situation, but it causes mental retardation. The key component to this is identifying earlier in life, because brain cells or nervous system still developing 6 months to a year after they're born. If we can get thyroxine supplemented in that time frame through tests and research they've done, they feel like they have restored the IQ range of that child with what it should have been originally. So can we prove exactly? Probably not, but that's their feeling of it. A clinical application up here on 339, here we have a goiter can produced by another mechanism in Graves' disease, autoantibodies. So Graves' disease is an autoimmune disease that's attacking the thyroid, and it simulates thyroid stimulating hormone, so we have oversecretion of thyroxine. And because of oversecretion of thyroxine, it's right the opposite of hypothyroidism. Here we have all kinds of conditions. Responsible for 50 to 80% of hyperthyroid cases is Graves' disease, often accompanied with exophthalmos, the bulging of the eyes you see down at the bottom, increased orbital fat, proliferation of fibroblasts, which secrete glycoproteins that retain water and produce even more edema. Symptoms include high BMR, weight loss, nervousness, irritability, intolerance to heat, and increased blood pressure. So everything hypothyroidism was, hyper is right the opposite. They think they can deal with cold. I mean, if you feed them enough, these people are going to eat like crazy and not gain any weight. We're going to diagnose them with ADHD. They're everywhere. Talking about increasing your metabolism here. Then on 340 is your parathyroid glands. Of course, we know they deal directly with calcium metabolism, and they lie side by side in there around that thyroid gland. Without enough calcium in the bloodstream, your muscles will cease contracting. If your diaphragm ceases, then obviously you're not going to breathe. So that's why calcium is important, and that hormone is so important. 341, pancreas. You have the pancreatic islets of Langerhans. You have alpha and beta cells. The alpha cells secrete glucagon, and the beta cells secrete insulin. Those two are antagonistic. Insulin takes up blood glucose, glucagon puts it back out there. They list on 342 in your clinical application, diabetes mellitus type 1 is, as far as I know, 100% insulin dependent. Type 2 doesn't have to be insulin dependent. A lot of times we can treat that by changing our health style, changing our lifestyle, types of food we eat, exercise, watching levels of glucose. We have lack of sensitivity or decreased sensitivity in the cells responding. And if we don't flood them too much, they can still get the job done. So just a diet can help maintain type 2 diabetes. It can reach a point that it may need insulin and turn to type 1. Hopefully not. Now they also list gestational diabetes. I know at least one of y'all's had children in here. A couple of y'all had children. You had to take a test for gestational diabetes at 20 weeks, something like that. When you drink this really wonderful Kool-Aid tasting stuff, right? Kind of disgusting. And they're trying to trigger it, in my opinion, because they make you drink all this disgusting high sugar content stuff just to see how your body's going to react to it. Isn't that nice to know? And if you're already sick at your stomach, you might as well just take a bucket with you, because it'll make you vomit. But gestational diabetes occurs in about 4% of pregnancies due to insulin secretion that is inadequate to meet the increased demand imposed upon by the fetus. So what happens is the body's trying to produce enough glucose out there for two of you now. And sometimes it produces too much, and your insulin don't keep that level back to a norm, and it explodes. So ultimately, down at the end, we end up with this huge baby if we don't get them here fast enough, because they got all kinds of glucose and they're growing like crazy. So women who do not develop gestational diabetes have sufficiently increased insulin secretion during pregnancy, probably due to proliferation of beta cells in the islets. So some people are just, I mean, it's 4%, it's not huge, but there's a lot of people stay a little bit borderline. If you don't pass the first test, you gotta go back and take a longer, more serious test. But it's just same torture, basically, and beyond. Sometimes they mess up on their test and you have to do it for no reason. Would you please do this again? The pineal gland. We studied the pineal gland just a little bit the other day, and we said it was directly associated with daylight. And it is in animals, and it really is with us as well. We said that increased daylight decreases melatonin. Okay? Decreased daylight increases melatonin, and that is what's causing the winter depression or the seasonal affective disorder, the SAD disease. Now, other things they've associated this with, I think we talked about in animals and birds, increased day length, decreased melatonin, increased gonadotrophic hormones, and the birds started reproducing in March and April, May and June because of lack of melatonin. That would not apply to humans because if it's dark outside, we go in and turn a light on. Now, they talk about a little bit of the day-night cycle here. During the day, neural pathways from the retina and the eyes to the hypothalamus act to depress activity of the SCN, reducing sympathetic stimulation of pineal and decreasing melatonin secretion. So that's the effect of light. The light comes in, it shuts down melatonin production, and technically you're more active and less depressed is what they're saying. And that's dealing with circadian rhythms is what that's dealing with, your day-night cycle. Anybody ever work shift work? No? Worked enough, it's hard to get shifted into the different sleeping arrangements. One time they have you on this shift, and then they put you on this shift, and I would probably never get used to sleeping all day and being up all night. If it's daylight, I'm outside doing something, I probably would never sleep. And then I'd pass out after a while because I gotta have my sleep. So shift work would be difficult for me. On 344, here's their theory on how it affects the onset of puberty. Excessive melatonin secretion in humans associated with delay in onset of puberty. Melatonin secretion is highest in children between ages of 1 and 5 and decreases thereafter, reaching its lowest levels at the end of puberty when concentrations are 75% lower than early childhood. So in their own way, they're saying that high levels of melatonin not only should make those kids sleep a little more, right? Sleeping will give us growth hormone while we're sleeping, but it slows down the possibility of them hitting puberty earlier than they should. Now, I don't know how to explain those odd situations like in other countries. In the U.S., we've got documented pregnancies at 9. In other countries, we're giving birth at 6. Pregnant at 5, give birth at 6. I can't explain that. Where was melatonin when we needed it? I don't know. But those were incest cases. It was back in the 60s, the one I'm thinking of, and they didn't have the tools or the manpower. They knew he did it, they just couldn't prove it. They just couldn't put him away. But yeah, she not only got pregnant at 5, but she carried the pregnancy and gave normal birth at 6. I just can't even fathom, because I've got a 6-year-old, and there's no way on earth she can't, her poor little baby doll, she doesn't know where it is right now. Well, one of them's in my truck. There's no telling. Poor kid's been stranded for weeks. So there's responsibility level, right? Melatonin pills. We talked about those being used as sleep aids. So then the last little section here, or one of the last sections, dealing with the gonads and placenta. We put up on the board the other day really the sequence of events for the gonads. And this would be the testes. Now, the term gonad is in reference to both. The testes, we had to have luteinizing hormone acting upon the Leydig cells to give us testosterone. And then we added FSH plus testosterone to give us spermatogenesis. Now, that's as simple as it gets with the guys. We'll save chapter 20 for the girls because it's going to take a while. It's an influx, deflux, upflux, downflux of hormones that we can never be able to explain. We'll just take a guess at it. They're all over the place. But the ultimate demise, we blame everything on hormones, do we not? Curly, you ever blame it on hormones? The ultimate demise is, it's not the hormones, it's the lack of. So we blame it on, well, if I just had more hormone, if I had a little more estrogen, I'd be more functional today. And that's probably the truth. For y'all, I mean, I don't need any more estrogen. The placenta, they mention it here, and I'll mention this just briefly. The placenta is an ultimate gland. And I say ultimate gland, this is the gland of pregnancy. It'll take over somewhere around the 8th week of pregnancy, and it is difficult to get rid of it, buddy. When it kicks in, it's holding on to that pregnancy. And you ever heard of postpartum depression? What causes it is delivery of the placenta. What's been maintaining all these hormones for the pregnancy? The placenta. When it goes out, it's just like removing a major gland, and you did. And then the body's got to get all of its hormones back in gear. So you can sure see where the lack of hormones causes this plummet, and postpartum depression can kick in. Some bodies adjust to it faster than others. A couple of terms on 346, autocrine regulators and paracrine regulators. Autocrine regulators regulate within themselves. It's a tissue that regulates itself. A paracrine regulator is a tissue that creates a secretion that regulates a neighboring tissue, usually in the same organ, but a neighboring tissue. For instance, epithelial cells lining vessels produces nitric oxide, which is a vasodilator for the smooth muscle that surrounds the epithelial cells. So that would be a paracrine regulator. Prostaglandins, last section of this, look on 348. And what we see here in prostaglandins is they're involved in about every system in the body. Immune system, reproductive system, digestive system, respiratory system, circulatory system, urinary system. We can relate this to a lot of things in humans. We can relate it to a lot of things in animals. Where do you think we learn a lot of this? Animal studies and animal trials. My brother has a master's degree in reproductive physiology and animal science. Okay? The first physiology class he took was human physiology. Okay? Y'all go on in the medical field, first class you take is human physiology. What's human physiology based off of? What little we know about humans and a whole lot of animal studies. So it applies to both if you think about it. It really does. And of course he went on and did his research with animals. And sometimes we can apply that back to humans. Sometimes you can't. But the association point comes in there somewhere. Immune system, prostaglandins play a role in inflammation. Inflammation and pain, really. Well, if you had inflammation and pain, what would you get across the counter? What kind of medication could you take that would help your inflammation and pain? Aspirin, all your variety of ibuprofens, Tylenol, all those are non-steroidal anti-inflammatory drugs. That's right. And they're free for the giving across the counter. And that's what they do. They're anti-inflammatory drugs. What they do is block the production of prostaglandins, certain prostaglandins. Aspirin can irritate the stomach, can it not? Well, prostaglandins are utilized in the stomach to produce a mucus lining, so when the acids are produced, the acids don't eat into the lining of the stomach. All right, so if you take aspirin, let's say it says take 2 aspirin every 4 hours, and you got a really bad headache, so you're going to kill this sucker, and you take 4. And I know nobody's guilty of that in here, but you take 4 on an empty stomach. Well, you stop the prostaglandin and you stop the headache, now your stomach's irritated. Because you also stopped the prostaglandin that was supposed to produce the mucus lining so you could actually digest the aspirin, Instead, there's no mucus lining, and now the aspirin's causing acid secretion because there's something in the stomach, and it's eating on the stomach too. See what I'm saying? So, a lot of drugs do what they say they're gonna do, but they're affecting something else too. There's a lot of those. So we're gonna take Tagamet, right? We got an upset stomach, so we're gonna take Tagamet now to cut the acid down. We're gonna counteract one medication with another. We're just a bunch of druggies. And it probably says something about a histamine type 2 blocker. Well, it probably worked for you. So just in case you wanna stop by the hot tamale on the way home and get you some tamales, you throw it in the glove box, just in case you might need to take it again later, because you like your spicy food. And you get in your car, not noticing there's a swarm of bees in there. As soon as you shut the door, they attack you. What do you have in the car that'll help you fight against, not necessarily kill the bees, but may keep you alive once you get rid of the bees? Tagamet. Because it's a histamine blocker. Histamine causes swelling, right? So if it blocks histamine, then you're taking a stomach acid preventer now as an anti-inflammatory. Just throw all your drugs in the glove box. You may need, I don't know if this is working or not, but I'm gonna take it. This will counteract this one. Hey, it's pretty amazing you get to studying some of those labels. And I've had students bring those labels up here before and just read them. Of course, after we read them, we all get depressed because we tried to kill ourselves several times taking this drug because it causes cancer, lupus, and autoimmune disease, and one eye sticks out and the other one sinks in, and one foot falls off, but we're still alive. The list is, hold it here and it drops to the floor, doesn't it? Yeah, but the immune system, reproductive system, oh, it plays a huge role in that, and that's a lot of the pain, menstrual cramps and things. So, I mean, ibuprofen supposedly helps that some, but what's Pamprin, is that the one that specializes in that because it has like something to reduce water retention or something in it. So, digestive system, we just mentioned on the digestive system, on the gastric acid production. Respiratory system, bronchial smooth muscle contractions or dilations, even constrictions in some cases. Circulatory system, vasoconstrictor in some ways, vasodilator in others. It just depends. I mean, and then urinary system causes vasodilation in the urinary system. And we could go on and on. I'll be surprised in the next edition or two, we don't have half a chapter on prostaglandins, but we know enough about them to be dangerous, but we don't know enough about them to really get elaborate on them. But we know they're out there and they're involved in a lot of things, and you take it to stop one over here, you've stopped one over here, and we probably still need this one. But you cause another problem by fixing one. And that's typical with all medications. Any questions? They do mention the said drugs there on the right, and they talk quite a bit about those non-steroidal anti-inflammatories that we all have in our purse, glove box, and cabinet at home. So that finishes chapter 11. And chapter 12, I want to do a quick introductory to chapter 12. There's only 3 or 4 pages I'm going to look at there, and then we have an overhead, and then we'll have a review on Monday. But going back to the aspirin thing in the stomach, there's 3 things as an adult that you can actually digest through your stomach walls. Anybody know what those are? Aspirin. Alcohol. Do what?
Steroids?
Nope. On 359 they list it. Botulism. It's not that we want to digest that as adults, but now as an infant, in the first 48 hours of your life, we can digest tons of large proteins. Where are we getting them? Mother's milk, colostrum. So it's important that we do digest these large proteins in mother's first milk and colostrum, but then the stomach seals off, only to allow, why, I don't know, aspirin, alcohol, and botulism to sneak through the stomach. So if you eat, you think poison food, and sometime tomorrow you're vomiting, say, oh, that must have been bad food yesterday. It wasn't. Botulism will hit you fast. It probably hits you before you get home. That's how fast it'll hit you. It won't be sometime in the night. it'll be within a couple hours maxed out, okay? That's food poisoning. Rest of it is virus, I don't know, whatever. It may have been bad food, it's sushi, but, anyway, in this chapter, like I said, I've got an overhead, I'm trying to find the page I want us to start at. It looks like it's gonna be page 370, so mark page 370. Have a little explanation to do on this. We're gonna go through a muscle contraction process, how we relax and contract, and then we'll explain rigor mortis. Which y'all understand rigor mortis. I see a little rigor mortis every morning in here at 9 o'clock, so, and then we'll review for the test. Any questions? All right, y'all have a good weekend.